Brachial plexus is the plexus of nerves which is formed by anterior rami of lower four cervicals and first thoracic, which are the C5, C6, C7, C8 and T1. Now the components of brachial plexus is roots, trunks, division, cords, branches. To remember this, you can use this trick which I made when I was in first year, which is root, trapec, car breaks, root, trunks, division, cords, branches. Here we have the brachial plexus. Now, in brachial plexus, the root shoulder that is formed by the anterior ramus of C5 spinula and C6 spinula, C7 spinula, CH and T1. Now this forms the root of brachial plexus. Now we know there is three trunks, superior, middle and inferior. Now the superior trunk is formed by C5 spinula and C6 spinula. Next we have the middle trunk which is formed by C7 spinula. Then we have the inferior trunk which is formed by C8 and T1 spinula. Now we know that superior trunk, middle trunk and inferior trunk further divides into the anterior and posterior division. Now each division of this forms cord. How is it formed? The superior trunk and the middle trunk, their interior divisions form the lateral cord. Then the inferior trunk and its anterior division forms the medial cord. Now this is the medial cord. Then we see that the posterior division of superior, middle and inferior trunk forms the posterior cord. These are the cords of brachial plexus. Now here we have the branches of lateral cord of brachial plexus. The first is lateral pectoral nerve, the second is lateral root of medial nerve, and the third is musculocutaneous nerve. Next we have branches of medial cord, medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of medial nerve, and ulnar nerve. At last we have the branches of posterior cord, radial nerve, axillary nerve, thoracodorsal nerve on nerve to latissimus dorsi, upper subscapular nerve, lower subscapular nerve. Here is the simpler representation of brachial plexus. You can take a screenshot if you want. Now we need to understand that at this point where the C5, C6 makes the superior trunk and then branches into anterior and posterior, we have two other nerves, that is the suprascapular and nerve to the subclavius. Now this point forms Erb's point. Now any damage to the Erb's point will lead to Erb's palsy. Now Erb's palsy or Erb's paralysis, the root nerve for that is C5 and C6. It is also called policeman's stiff hand or porter's stiff hand or writer's stiff hand. What we see as clinical features is there's adduction of arm, which is due to the paralysis of deltoid muscles, medial rotation of arm, which is due to the supraspinatus muscle, infraspinatus muscle, and pteryspinal muscle. There's extension of elbow, which is due to biceps brachii. There's also pronation of forearm, which is also due to biceps brachii. We also see there is sensory loss along the outer aspect of arm. Next, we have the clumps paralysis, in which the nerve involved is C8, T1. Sometimes there's also C7. The clinical features are claw hand. Remember in that we had the policeman's stiff hand. Here we have the claw hand, which is due to the flexors of wrist and finger. There's also loss of sensation along the medial border of forearm and arm. And we also see Horner syndrome. Now what is Horner syndrome? Now Horner syndrome is characterized by partial ptosis, meiosis and hydrosis and ophthalmos, which is due to involvement of sympathetic fibers supplying head and neck, which leave the spinal cord through T1.